let's remove this unfair, already constrained lack of competition we have between. We already have a huge public program. So let's say you are going to be able, and if you're poor, 200% or below the poverty level, you will have a voucher that you can work through the Treasury to be able to say, this is the company I'm going to buy my health insurance from, and that check will go directly to that health insurance, and you will be covered, and you will not be showing up in the emergency room. And the amount of money that will save by not cost shifting in the private health insurance will dramatically lower the cost. You can buy across state lines. You can you have portability, because today people have 4 jobs a year. You have portability. You know, so all the things that Americans and some of the proposals of the Democrats agree on. We have to have competition. We have to insure everyone. We have to have portability, no pre-existing conditions. All those are in that bill. I think it's an excellent idea. Let the free market work, truly work, and see what happens.
Government gets involved, or ought to be getting involved, is to give people incentives to do the right things, not the wrong things. I mean, this particular, well, that particular plan would probably cause private insurers to say, small businessmen to say, I'm not going to cover you anymore. Go get on the government plan. Why should I pay for it? Why should you pay for it? That's free. We've got to remember that we've got to encourage people to do the right thing and be personally responsible, not to throw up their hands and go, why should I try when this is all out there for free, and the people that aren't working hard for that.
The Obama plan, I think, really threatens the interests of many people, especially many senior citizens who are already satisfactorily cared for, according to, as I say, polling data. And the theory behind the Obama plan is you're going to have this mandate where everybody has to spend a little more money in order to cover more people. And the theory is that there's this class of people out there. You know, some of them are seniors. Some of them are young and healthy and uninsured and broke who have decided not to take on insurance for themselves, and that's why they don't have insurance. And these people are Obama voters, and I think that they started by believing that health care reform was going to give them cheap insurance and not significantly raise their own obligations in order to pay for other people's health conditions. And of course, reality is dawning. And that is why health care reform is having such immense difficulty in Congress now. And people are discovering that in order to have Obama health care reform, we're going to have to dip into the pockets of people who already have insurance. This means people are going to have to pay higher premiums or pay higher taxes, or they're going to have to get less stuff. There's no way out of it, given the system that Obama has proposed. And that is why the current system that's proposed in those 6 volumes there, that's just one bill, that is why the current system presents such a threat to people who are cared for, whether they're senior citizens or working poor, or just about any of us who are satisfied with our current health insurance.
What is their mandate, and could they decide that elective abortions is a proper thing that the government should pay for? Is that within the realm of things?
The greatest concern, to my mind, is that the way the system's set up right now is doctors get reimbursed when they do a procedure. So one thing this bill is talking about is doctors are going to have a financial incentive to do a certain type of procedure, which is a kind of death counseling. And so doctors are going to have this incentive to do this death counseling. I think that is a very morally troubling thing. Did you ask about? Yes, it does. It goes against the Hippocratic Oath. That's absolutely right. Did you also ask about abortion?
I thought there was a panel that would decide what procedures or medical advisory and all that kind of stuff. What's the name of that panel?
Something like that has evolved in England, and is almost necessarily going to evolve in a lot of different systems. And so that is something to be wary of. But I think it's
I don't know the name.
He says it's Benefit Advisory Commission.
That's it. I know that it consists of 26 members, 17 of which are appointed by the President of the United States.
And our National Republican Party. I am so sick and tired of being ignored. They should be standing up for their beliefs. What we need is another, Tea Party?
News program.
Contract with America. Contract with America. What principles does the Republican Party really have? you to pass that message. I called and I left that message with Washington, and I want you to do that, because this is ridiculous. They don't stand up for themselves. George Bush let the Democrats demean him,
Let me say this, and I
and
can't.
never stood up for
I will
himself.
not defend the last 8 years, but I can tell you that Michael Steele was in Arkansas this past week, taking Mike Ross to task, taking Blanche Lincoln to task, and he's traveling middle America, taking them to task. And as a member of the Republican National Committee, we know that the last 8 years were not what we need to be. The Republican National Committee let the people down.
But now, where are they now? Where are they now? They allow the Democrats to say they're the party of no. When you have when the Republicans have their own bill.
I understand. It's, when there's so many, and once again, I'm not defending, but I'll say that they tried to pass 400 amendments.
Where is that?
We don't control the media.
That's right.
We
We're
don't
not
control the
controlling the
media.
media, but you can still call your press conference.
That's one reason we're going around the state to inform over about this election.
My question to the panel here is, how can we get our message to Washington to the point where they will listen to us? Your state elected officials, you listen well, I know all of you personally, but how do we take this message to Washington? They don't listen, they won't return phone calls, and if you have the time and the diligence to write a letter on, you get back in the form letter. I'm semantic and spit bean. It's aggravating. Do any of you know how we can get the ear of Washington?
And I felt what we lack right now is leadership. We lack leadership in the United States Senate. That's why I'm running. That's why I'm going to beat Blanche Lincoln with your help. You don't know me now, but you will. I promise. In the next few months, I'll get around to every county. You're going to see me around a lot. I'm not a polished politician. Every word that comes out of my mouth is not perfect. But I can tell you one thing: honesty, integrity, and all those things we talked about. I've got them all, and I'm going to take them to D.C. when I go there. I want to add one thing about this health care bill. Congress didn't write this. The guy that wrote this is a guy named Jacob Hasker. Google him. Jacob Hasker. He is actually a Harvard-trained professor, and he's at UC Berkeley. He's got about 11. He worked for the Agency of Shared Prosperity. He wrote this in 2006. It formed the nucleus of Hillary's campaign, her health care bill. Also for Obama. So this has been around for a couple of years. If you just Google that, you'll get an 11-page document that he wrote. You can read it. You can see what the intent for this particular plan
We have
is.
set that document aside because we wanted things from government, and that started back quite a few years ago. Typically, we cite the 1932 election. I think we've got a long way to go to get control back from the federal government. But it is up to us to do it. We put it in. I mean, we really shouldn't point fingers. We've done it by letting it be done to us. So we are the ones that have to stand up and take it back. This document will still work, but we've got to do a lot of work on it. Thank you.